from the partnership, our open house session 1. Welcome everyone. My name is Corinne Daly. I'm the director of the diagnosis and clinical care team, and here joined by many of my colleagues here at the partnership who are supporting this initiative. And we'll do a couple of introductions later on down in the slides. Welcome, thank you very much for joining. We've invited a number of our partners, stakeholders, and colleagues from jurisdictional cancer programs, government groups, agencies, etc. So you may have been forwarded this invitation by some of your colleagues, and welcome everyone. Just wanted to let you know that we are recording this session. It has started, and so this recording will be shared on our partner site along with a number of other resources that we are keeping live and active to help support this initiative along the way. So we are going to all get comfortable together and start with a little bit of welcome and introduction. So if we can move to the next slide, please. We are probably joined by a number of colleagues across the country. Can we go to the next slide? Oh, perfect, we're there. And wanted to test out a little bit of use of our Menti poll that we'll be using to help facilitate through today. So if you want to open up your browser and go to menti.com, there's a code there that you can enter, 47691141, which will also be posted here in the chat for you. And we would love to hear from you about what jurisdiction you are calling in from today. And then we will show the results of where people are coming from. Unfortunately, we have a bit of a packed agenda here for the next hour and a half, so we don't have time to do roundtable introductions with everyone, but I would welcome you to include your name and the organization that you are joining from in the chat so that everyone can see where everyone is coming from. And look at that, we have representation all generally across from west to east. That's fantastic, what a great tool. So we're going to use that Menti, the same question polling to help field questions. So if you have questions that are coming up through our presentation today, would welcome you to enter them there. We'll be tracking them and reporting on them at the end of the session where we have time for question and answer. So we are going to go through a couple of just housekeeping items on the next slide, please, and then I will move us on. So a couple of things from us. We're using the Microsoft Teams platform today to be sharing with you this presentation. You will also find that in the meeting invite where you found the link to join the presentation, there are a number of materials there to support this, including a deck of both English and French slides, a link to a frequently asked questions document where you will find a lot of the information that we're sharing with you today presented in there as well. This webinar is recorded, so you're more than welcome to go back, and we'll be sharing the link to this recorded webinar on our partner space. So, please feel free to add questions in through Menti, and then we'll be keeping track of them and updating our FAQ. Through the team space, there's a couple of different functions, including your camera, your microphone, a hands up function, etc. Hopefully, and I think everyone's already there, is stay on mute if you're not speaking, and feel free to stay off camera as well. Also, we have someone monitoring our chat and hands, so please use the raise your hand function at the top if you'd like to add something. Also, if you're having issues seeing the presentation, please refer to the slides that are in the meeting invite. And if there are any technical difficulties, please use the chat function and we will try to get to you with help. If you do have any questions and you can't enter them into Menti, please feel free to enter them into the Teams chat and we'll be sure to capture them. So we are going to move on, I think, and do a couple of introductions, and then move forward. So like I said, I'm joined here by a number of colleagues from the partnership who are here helping to support the Models of Care initiative. I'm Corrine, and my co-lead for this initiative is Raquel Shaw-Moxham from the Person-Centered Perspective team. Here are the faces and the people that you'll be hearing from today. Unfortunately, our colleague Cheryl Lozado is away sick, so Raquel and Tanya are going to be stepping in for a couple of slides. You're going to hear from Farah shortly, and then other speakers today are Cynthia, Kristen, and Jessica. And we are pleased to be joined by our patient and family advisor, Lisa Widget, who you'll be hearing from a little later in the presentation, who's a mother, a wife, a sister, a daughter, and a breast cancer survivor. She has a bachelor's degree in education. She is First Nations and is joining us today from Haida Gwaii, British Columbia. Hopefully I've pronounced that somewhat well. So Farah, I'm going to hand it over to you to kick off our meeting in a good way with the land acknowledgement.
Thank you, Corrine. So so just to let people know, I'm Farah McCrate, and I'm pretty recently onboarded to CPAC as the regional lead for Atlantic Canada. And today I'm joining you from Logie Bay, Newfoundland and Labrador. And yes, I'm honored to have been asked to offer a land acknowledgement, as well as some other brief reflections on my own journey towards reconciliation. So to begin, I respectfully acknowledge this land, where I'm based, as the ancestral homelands of the Beothuk, whose culture has been lost forever and can never be recovered. I also acknowledge the island of Uktahunguk, that's Mi'kmaq for Newfoundland, as the unceded traditional territory of the Beothuk and the Mi'kmaq. And I acknowledge Labrador as the traditional and ancestral homes of the Innu of Nitassinan, the Inuit of Nunatsiavut, and the Inuit of Nunatukavut. I recognize all First Peoples who were here before us, those who live with us now, and the 7 generations to come. As First Peoples have done since time immemorial, I strive to be a responsible steward of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in a spirit of truth and reconciliation to make a better future for all. So as part of my own learning path around truth and reconciliation, really, I could say that started a few years ago, beginning with my involvement actually in a CPAC-funded project that was done in collaboration with the Cancer Care Program in Newfoundland and Labrador and several other valued partners. And the name of that project was Journey in the Big Land. So during this project, I had the opportunity to work with the Nunatsiavut and Nunatukavut Inuit and the Innu of Labrador. And this still stands out as one of the most rewarding and transformative opportunities in my career. It was a privilege to work with these gracious and resilient people, but that also came with a responsibility to learn about the history of Canada, a very different history than the version that I had previously known. Through participating in cultural competency training, through listening to Inuit and Innu people talking about their lived experiences, and through other learning opportunities, I've come to an understanding of a more complete and accurate picture of this country. And this journey was definitely coupled with some feelings of embarrassment and shame about not knowing more. And sometimes I still sit with those feelings. But also, about having a narrative in my mind that in some ways was all wrong. The more I learned, the more my respect and esteem for Indigenous people grew, as did my empathy and my outrage for the injustices perpetrated both historically and current day. I do feel reassured that my daughter and her peers will grow up as better informed citizens of this country than I did. In an effort to move towards reconciliation, I have continued to educate myself. I have read the Truth and Reconciliation Commission calls to action. I have purchased and read or listened to several books that offer accounts from the Indigenous voice, including The Inconvenient Indian by Thomas King, Five Little Indians by Michelle Good, and All Our Relations by Tanya Talaga. And I will continue to look for recommendations and examples of learnings that amplify the Indigenous voice. I'm a member of First Light, which is our local friendship center. And right now, I guess in an effort to move from a period of contemplation and reflection and into one of action, I'm hoping to take part in some of their activities this month, including looking for volunteer opportunities and other ways that I can contribute. So finally, to bring it back to the land, and you'll see from the pictures that are up there, they're all pictures of different places in my home province, and particularly on the island of Newfoundland. All taken by me, except for the kayaking picture in which that is me, that's sitting there looking at an ecological reserve on the southern shore of the province. But I do feel a strong connection to land and to animals. And I acknowledge my privilege as a settler on this land and the privileges I have to enjoy this land. The time I spend outdoors benefits my physical and mental health greatly. And I feel that, as I age, and the more I have the opportunity to do this, my worldview aligns more and more with what Indigenous people have known all along and what they try to teach us, which is that we all have an accountability to be stewards of the natural world, that everything depends on balance and interconnectedness, and that I, nor anyone else, has any more right to be here than any other living thing. Thank you.
Thank you very much, Farah, for kicking this off. What a wonderful land acknowledgement. So I'm going to just transition us over to our objectives and agenda quickly before we go into some context setting. And just a reminder for everyone, please turn off your camera at this time as we go through the presentation. So the objectives really of this open house are to provide an overview of the Models of Care Funding Initiative, objectives and scope, and to share with you how this work is grounded really in the broader Canadian Strategy for Cancer Control, as well as describe the intention of the Models of Care Planning Survey that has been shared out and is live and active, and help answer and respond questions to the purpose of this and anything that you might be working through, to provide insight into health equity focus goals of this Models of Care project. We have lots of conversation around that, and we're really hoping to bring you along in this journey with us, as well as provide an opportunity for you to bring questions forward to us to help us better respond to the things that you're working through. And we have a dedicated time at the end for a facilitated Q&A session. So let's move forward. Also, I'll just note we're going to be talking a little bit about different avenues of this Models of Care work, and you might hear the word the Indigenous-led piece of work. So we do have we will have a dedicated stream for projects that are led by Indigenous organizations, governments, and communities, and that will be run on a separate parallel stream with dedicated people and an advisory structure. So we are not talking today specifically about that Indigenous-led stream, but we will get in a little bit more to how projects will or can involve First Nations and Inuit Métis in this work. So the agenda for today really is we're sharing a bunch of information with you over the next 50 minutes or so, and then we have a facilitated Q&A. We're going to move into some context setting next, talk about the initiative overall and the survey, and then really spend a big chunk of time on advancing health equity, hearing from Lisa, our patient and family advisor, and talking about how to embed equity in your program design, which Tanya, Raquel, and Jessica will bring us through. And then at the end, we'll have time for some closing remarks, next steps, and things that you should watch out for as we move forward. Okay, so moving into our overview and context setting. As you're aware, a Canadian Strategy for Cancer Control was issued a couple of years ago in partnership with many of you and people across the country. And we can go to the next slide. This is really the work that we're talking about today is situated within our larger 10-year cancer strategy, but specifically in our next, the partnership's next 5-year business plan. Equity, as you'll see, is embedded as one of the ultimate outcomes of the strategy, understanding that all people in Canada should have access to high quality care. We now need to look at how to embed equity, and the partnership is on this journey of being very specific and purposeful in doing this moving forward. So health equity is essentially created when individuals across the country have a fair opportunity to access care. At the partnership, we define health equity, as I had just stated, and recognize that many causes of health inequities relate to social and environmental factors, including income, social status, race, gender, education, etc. Achieving health equity requires reducing unnecessary and avoidable differences, and that involves us thinking about how to design work to improve health equity from the start and involving those that are most impacted by the inequities. You'll see here that a couple of priorities are highlighted on this screen, essentially priority 2, priority 3, priority 5, and priority 7 of the strategy. Our work really cuts across all of these. And priority 7 here is the people-specific self-determined cancer care, where we are going to have that Indigenous-led models of care work that we won't discuss explicitly today. So we can move on. So wanting to really draw the lines here between our strategy and the models of care funding initiative, understanding that we are in a unique time here in the country where many organizations and jurisdictions are thinking about the impacts that the pandemic had, the inequities that already existed and that were exacerbated by the pandemic, as well as the health human resources crisis that this country has been in, understanding that there's a demand for care closer to home, more person-centered care, and essentially how do we make the utmost of the resources that we do have in place. So thinking about this holistically, the Models of Care initiative is really a strategic initiative overall that would support the priorities of our business plan in advancing overall the goals of the strategy. Now, the way in which we are talking about models of care is rather broad, really defining it in the way that health services are designed and delivered for a person as they progress through the stages of a condition. And given that we're the Canadian Partnership Against Cancer, we are talking about the cancer care continuum here. So we have a set bucket of funds that are put together here overall for these different priorities, understanding an early diagnosis, about $4 million, treatment, $3 million, survivorship, $2 million, and palliative, $4 million. And that in our Indigenous-led stream, we have set up at least set aside $1 million there to support those projects. Yes, and thank you. This is the French of the slide. You'll see that we have both English and French on these slides, and in some cases French on separate slides. So I think that's all from me in terms of setting up this initiative, and I'm going to turn it over to Kristen, who's going to talk a little bit more specifically about the Models of Care initiative, the impetus behind this, and where we see us all going. So over to you, Kristen.
Thank you, Corrine. Okay, just a reminder, if you have any questions while we present, please input your questions through the Menti. Again, here's the code, and we will address your questions at the Q&A portion at the end of the session. Next slide, please. So an impetus to the Models of Care work were concerns from cancer programs regarding the imperative to reduce inequities in delivery of care and health outcomes, the rising burden of cancer, the rising survivorship population whose needs are not met, and increasing expectations for person-centered care closer to home. And all these concerns put increased pressure on the cancer care system and providers, resulting in staff shortages, and this further compounded the problem. The partnership, working with our partners and people living in Canada, refreshed the Canadian strategy for cancer control. And health equity is embedded in one of the ultimate outcomes of the strategy. So we're now heading down the road to closing the gap and committed to supporting First Nations, Inuit, and Métis-led work by fostering opportunities for collaboration and co-design. So then, the COVID pandemic hit. And so, we're all in a different place now. And it really exacerbated the need to close the health equity gap. The pandemic has put unprecedented stress on the healthcare system, but through the crisis, we've seen, new innovations and opportunities for change, leading to the Models of Care funding initiative. Next slide, please. So the partnership launched the Models of Care Toolkit in March of 2022, so just recently, to help cancer programs address common issues within the cancer system. We wanted to provide a tool that addressed specific challenges identified by jurisdictions and partners. So the toolkit includes specific models of care, together with examples of those models in place across Canada and internationally. Next slide, and this is the French slide. You can find the toolkit on the partnership's website, so at the link at the bottom of the slide here. And also we held a Models of Care Toolkit webinar on May 17th, and you can listen to the recording, and a link to the recording can be found in the chat box. Next slide, please. So building on the development of the Models of Care Toolkit, the partnership will be working with cancer programs and community partners to support the implementation and evaluation of models of care in the 4 areas, as Corrine mentioned: early diagnosis, treatment, survivorship, palliative care. So our goals are to support the implementation of models of care that advance health equity, efficiency, and quality of care over the next 1 to 4 years. You can find the definitions of health equity, quality, and efficiency in our frequently asked questions document, which you can find on the online partner space. Next slide, please. Oh, thank you, Genevieve. So to increase collaboration between jurisdictional healthcare systems and community groups representing the interests of those who experience the greatest disparities in cancer care in Canada. So you can go back, Genevieve. And to support the implementation of new models of care that can address system pressures and support pandemic recovery and resilience. So those are the goals of the project. And now next slide, please. So health equity is, as Corrine mentioned, is at the forefront as the partnership moves forward with our 2022 to 27 work. And that really requires new ways of thinking and working. So the partnership has adopted an equity first approach so that all the planning, implementation, evaluation of all of our initiatives are focused on populations that are experiencing disparities. So all models of care projects will be required to focus on health equity. So this can include either or addressing the needs of populations that are systemically and historically excluded from the healthcare system. So these are populations that experience barriers in access, have poor outcomes, less satisfactory experience with their cancer journey, and or may include efforts to reinforce a commitment to reconciliation with First Nations, Inuit, and Métis. So when we talk about equity deserving groups, we're talking about groups such as racialized communities, sexual and gender minorities, those living in rural and remote areas, those living on lower income, and those experiencing food and housing insecurity. But having said that, any work we do with First Nations, Inuit, Métis populations, if this is your area of focus, must be based on their self-identified priorities. And as Corrine mentioned, we will be working in parallel on Indigenous models of care projects. Now we're going to turn it over to Cynthia, who's going to speak to the Models of Care Planning Survey.
Thanks, Kristen. You can go to the next slide, please. Okay, so I'm going to spend a couple of minutes just walking you through the planning survey. So as a reminder, the planning survey was sent out on May the 16th. The focus is to better understand your priorities to support implementation of a model of care project and identify the supports that would be helpful during both your planning and implementation of your model of care. We understand that all of you are at different levels of readiness and are requesting that you complete the survey with what you know today. It's okay not to have all the answers. The planning survey is a way for the partnership to develop a pipeline, and submitting a survey with an early idea is a great way to signal to us you're interested. Jurisdictions can submit up to 3 surveys, so it's important that you coordinate with others in your jurisdiction to determine what to submit. Financial support is also available during planning and is not part of the funding envelope. Next slide, please. Okay, so I'm just going to quickly walk you through the 4 sections of the survey. So the first section is quite simple. It's just collecting some basic project information and identifying the area of focus that both Kristen and Corinne already spoke to. Next slide, please. And the end of section 1 focuses on identifying the communities or populations that experience health inequities in your jurisdiction and how your model of care will address these inequities. We recognize that some of you will have established relationships with these communities, and some of you may have none, and that's okay. This will help the partnership understand how we can best support you. Next slide, please. So the second section focuses on timelines and budget. So we're asking for an estimated budget that you anticipate you would require to implement your model of care. So this is not about planning, it's about the actual implementation of your project. And this would be exclusive to the planning funds mentioned previously. While we know many of you are in the early stages of planning, providing us with a rough estimate of your budget will be really helpful. And of course, we understand that this will continue to evolve and change. We're also looking for the date when you plan to be ready to start developing your proposal to implement your model of care. So when you will be completed your planning stage. Next slide, please. Thank you. So section 3 is focused on the supports that are required for planning. So as mentioned, the partnership has set aside planning funds to support project planning. Allocation of these funds will be determined as part of the survey assessment process and through individual consultation with all of you. In addition to planning funds, the partnership can also provide other supports to you during this phase of planning. So for example, project management support, you may need resources, tools, and or advisory support to help think about performance measurement or evaluation, sustainability, etc. Next slide, please. Okay, so the last section is a very simple question. The purpose is for us to just collect the contact information for those who you anticipate will be involved in your project, just so that we can contact the right people to follow up, to have some additional conversations. And next slide, please. So health equity and clinical advisors will be supporting the partnership to review surveys to ensure funded projects drive health equity and quality and are diverse in nature. Surveys serve as a starting point to inform follow-up conversations with all of you. We are providing up to 3 years of funding for these projects. So as I mentioned before, even if you're not ready now, but think you may be ready, it's important to complete a survey to give yourself enough time to start working through your idea and for us to support you. So just as a reminder, the survey close date is June the 13th. And if you need assistance with completing the survey, please feel free to reach out to us. There's a contact email at the end of the presentation, so please feel free to reach out. And with that, I'm going to turn it over to Raquel to talk a little bit about advancing health equity.
Thank you, Cynthia. I just want to do a quick reminder that if you have any questions, please submit them to our Menti pool. Next slide, please. So it's my pleasure to just get a bit deeper into our CPAC's work and commitment to advancing health equity with our partners. As Corinne and Kristen and Cynthia have already stated, health equity is embedded into the Canadian Strategy for Cancer Control. And it is embedded into our role and CPAC's commitment to the 2022-2027 business plan. The partnership's role in grounded in health is partnership's role in health equity is basically grounded in what we can do to improve access to high quality cancer care to those that are underserved. Our work to advance health equity with our partners is foundational in the work that's already underway, in our commitment to diversity, equity, inclusion, in the internal functions and culture of the work within CPAC, and our role and commitment to supporting reconciliation with First Nation, Inuit, and Métis. There are some key principles that are guiding our work. Number 1 is to address the needs of people who are systemically excluded from the healthcare system. We are grounded in our commitment to reconciliation with First Nations, Inuit, and Métis. And thirdly, we have to seek to understand at the outset who's experiencing equity and equitable access to care, and to look to co-develop solutions that strengthen access to health equity based on existing shared priorities, leveraging community strengths, and knowledge. Next slide, please. The partnership's commitment to advancing health equity